Our first patient complains of primary impingement, so any movement that is going to decrease the subacromial space is going to be restricted. So that includes movements like flexion and internal rotation. So to facilitate those two movements, we will do a posterior glide. So start right here, and on the humerus. Beginning with a sustained grade 2, observing physiognomy and reactivity. Everything all right?
Yep.
And progressing to an oscillatory grade 3. Everything okay?
Yep.
Perfect. And I'm going to be doing this for about 6 to 8 times with a short break just to ask about reactivity. Everything okay?
Yep.
And we're going to continue, and I'm going to be doing this for a total time of about 1 to 2 minutes. Our next patient has patellofemoral pain syndrome, so some weaknesses that are associated with this pathology are going to be in hip abduction and external rotation. So we're going to do a couple exercises to address those weaknesses. First, we're going to do hip abduction. So we're just going to be doing this movement right here. Alright, and I'm going to add some resistance, so go ahead and continue. Perfect. Is that alright?
Yep.
Perfect. Keep continuing. Alright, and go ahead and relax. Alright, so we're going to do that 10 repetitions for 3 sets, 3 times a week. Moving right along, we're going to do external rotation with the hip flex to 90 and the knee flex to 90. So the movement that we're going to be doing is this right here. Alright.
Okay.
So one more time on your own. Alright, adding some resistance now. Perfect. Perfect. Again, and one more. Perfect. And again, we're going to do that for 10 repetitions for 3 sets, 3 times a week. Our next patient is about 8 weeks status post rotator cuff repair surgery, so they're in the minimum protection phase of tissue healing. So what we're going to do is some passive range of motion first, and then some active range of motion to restore the functionality of her shoulder. So we'll start out with some external rotation. So we're going to bring the humerus out to their side, and we're going to slowly bring it down. Is that alright? And we're going to do this for about 10 repetitions for 3 sets, observing physiognomy and reactivity. From there, we're going to progress to active assisted range of motion. So we're going to use a wand right there, having the patient's elbow at her side, and go ahead and use that hand to push out to the side just like that. Perfect. And come back, and then back again. And we're going to do this again for 10 repetitions for 3 sets. Our next patient has some neuromobility issues, so we're going to do the slump sit maneuver. So I'm going to have my patient have a slump posture, and I'm going to add a little bit of overpressure, and then I'm going to ask her to flex her neck and add some overpressure to her head here. And then I'm going to have you kick your left foot out, and I'm going to grab onto her foot, and then I'm going to passively dorsiflex her foot. And now she is at maximum neural tension, so to do a neural tensioner, we're going to just simply plantar flex the foot, and then dorsiflex. Plantar flex, and dorsiflex. And we're going to do that 10 times, progressing now to a neural slide or floss. What we're going to have the patient do is go ahead and extend your neck, and then simultaneously we're going to have you flex your neck as a plantar flex, and then extend your neck as we dorsiflex. And again, and more, and again. And again, we're going to do that 10 times, observing reactivity in the physiognomy while we do it.